Hello everyone. Today's video is about high-dose sulfur therapy. Just before jumping into the video, if you don't mind taking a quick moment to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. And as per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So this is a video that I've been excited to put out for a little while now. I learned about high-dose sulfur therapy several months ago, and I started using it in practice. I started seeing encouraging results right out of the gate, started seeing even better and better results, started seeing it making a big difference for some of my really tough cases, and then saw that benefit that I was seeing in those really tough cases get even better over time and sustain over time. And so I was kind of waiting until about now to put this video out there because I didn't want to prematurely make a video about something that I was really excited about, but I feel like it's this high-dose sulfur therapy is standing the test of time in my practice, and so I'm excited to make a video about it. So to give a little bit of a backstory, several months ago, I did this course with this naturopathic doctor from Washington named Kathleen Janelle. She's been interviewed on different podcasts. She has a website, which I believe is gijanelle.com. She treats a lot of gastrointestinal issues. Her last name's Janelle. Kind of sounds like G.I. Jane, I think, is maybe a little bit of a pun there or something. I'm not sure. That's where my brain goes anyways, but so she's gijanelle.com. So if you want to check her out, she has a free ebook and Instagram page and all that good stuff. So I took the course with Dr. Janelle, and she was talking about high-dose sulfur therapy, which I'd never heard of before. And so I was interested to learn about it. It was advertised like this, treatment for gastrointestinal issues. I treat a lot of gastrointestinal issues, so I was excited to learn about it. So to make a long story short, she made a very good case that a lot of us are likely sulfur deficient, in large part due to heavy pesticide use in our food production, damages the soil microbiome, interferes with the nutrient levels in our soil. Plants become nutrient deficient. Animals eating the plants become nutrient deficient. So we eat the plants, we eat the animals. They don't have as much sulfur. We have less sulfur, and not having enough sulfur is really problematic. Sulfur is really important for our connective tissues, so for like ligaments and joints and tendons, cartilage, that kind of thing. It's really important for our sulfation pathways in our livers. It's very important for our gastrointestinal health, gastrointestinal motility, our hair, our skin, our nails. So it has all these different really crucial properties. Also important for our mitochondrial function. So I was a little embarrassed when I knew that sulfur was a component of the mitochondria, the electron transport chain complexes and whatnot, but just didn't really piece together how I just never thought about sulfur deficiency before. I hadn't really heard much about it, maybe some little blips here and there, but never really heard about any treatment protocols, so I just didn't really pay much attention to it, to be honest. So Dr. Janelle was talking about her extensive experience, 25 plus years of experience using this in practice and just helping a lot of folks with really, really difficult chronic gastrointestinal issues, but helping with a lot of other health issues too, because sulfur is just so applicable to a lot of different areas of our physiology. So I took the course. I was really inspired. I started taking sulfur myself, that day because I happened to have a container of it kicking around. Started taking some and have been taking it ever since. But to be honest, I do a lot of courses, I do a lot of extra learning, a lot of continuing education, and I'm always a little bit of I'm an optimistic guy, but I'm also a little bit skeptical in that sometimes what seems to really work well for one clinician, I don't necessarily see those same results in my practice. So I started talking to some of my patients about this, recommending that they give it a try, and my patients are wonderful, and oftentimes are good sports to give things a go, and so some of them were like, yeah, sure, I'll give this a try. So started working with it, and I've been really, really happy with the treatment results so far, in terms of helping with gas and bloating, helping with other chronic digestive issues, helping with chronic constipation, helping with some patients with chronic skin issues, helping with joint pain. The sulfur seems to have this general anti-inflammatory effect for some patients, so helping some folks with autoimmune-related conditions. I've had 3 or 4 patients now where, try as we might, we're having a heck of a time with their thinning hair or their kind of weak, kind of brittle hair. I'm not a hair specialist, but I have had many patients over the years with hair-related concerns, and oftentimes things like mineral supplements and getting their guts on track are helpful. But I had a handful of patients that nothing was really moving the needle, or at least not in a fast way, and the sulfurs made a big difference for them. couple of patients now with some chronic skin issues where their skin's doing a lot better. So I've been seeing a lot of really encouraging results with the sulfur, primarily in the gastrointestinal and the joint pain, like aches and pains realm, but seeing other spillover effects in other areas too. So I've been very, very excited about it. I see that the time on my video is winding down, so just a couple of quick things I want to make sure that I mention here. So one is, like, what is the sulfur protocol? Like, do you have to, eat a big stinky lump of the yellow stuff that we maybe played with or smelled in chemistry class? Do you have to eat 10 dozen eggs a day? Like, how does this work? So the best sulfur supplement, to my understanding, according to what I learned from Dr. Janelle, is this supplement called MSM. MSM is an acronym for methyl sulfonylmethane. It's an old-timey supplement. It's been, relatively speaking, it's been on the market for like 35 plus years. It's something that I've prescribed to many patients over the years because it's part of various joint support formulas, usually combined with glucosamine or chondroitin. So I prescribed it many, many times, but at a much lower dose than what's typically required for folks to feel better. Dr. Janelle, in her interviews, and I believe in her ebook and whatnot, she gets into dosing and all of that. As anyone who's listened to my other videos knows, I'm not able to give any treatment advice. We have a lot of limitations on what we're allowed to talk about as naturopathic doctors here in Canada in terms of dosing, and don't be construed as giving advice. So I'm not going to get into dosing now, but the standard dose of MSM, if you were to follow the directions on the bottle, it is a far cry from the dosage required to get those adequate sulfur levels on track. So I believe Dr. Janelle, maybe different rules maybe around what she's allowed to say. I believe she kind of gets into more of the protocol stuff and some of her materials. If you want to check that out, fill your boots. But it's something that does require a fairly high dose of this MSM supplement. I will say that about 25 to 30% of my patients, as they're building up their dose of their MSM, they do have some detoxification reactions. So I recommend for my patients to start low, build up gradually, build up slow. And what else did I want to mention? I was also going to mention that two things. So one is that one of the many reasons I'm excited about MSM, aside from the fact I'm seeing it working well in practice, is that I just love the fact that it's correcting a deficiency. It's all well and good if someone's like, we found this new plant extract in the middle of the Amazon rainforest, and it's really helping in this SIBO trial, or it's really helping for joint pain. It's this rare thing. One company sells it, it's $400 a bottle, but like it seems to be helping people. That's all well and good, but I get much more excited about, we have a plausible mechanism by which people are deficient in this nutrient. We're going to correct that deficiency, and they're going to start feeling better. We're going to get their physiology working better because we're correcting a deficiency. And MSM is inexpensive. It is cheap, even at high dosages. It's maybe give or take $30 to $40 a month, give or take. So inexpensive, correcting a deficiency. Very, very exciting, as you can maybe tell from my video here. So quite excited about it. The last thing that I think I wanted to mention here, maybe there's something else, but one of the last things anyways, is that I am going to be interviewing Dr. Janelle for my podcast, my Overcoming Chronic Illness podcast. So I'll be interviewing her in actually just a few days on September 16th. I will not be posting that recording for probably a good 6 weeks or so, give or take. But if you're listening to this and you're interested in this topic, if you have any questions that you'd like me to ask her, feel free to post in the comment section below if you're watching this on YouTube, or post a comment on Instagram, or wherever you happen to be accessing this video, and happy to ask questions if they fit in with the flow of the interview. So I'm really looking forward to picking her brain, because now that I've been seeing so many things in clinical practice with this, I have a whole bunch of additional questions for her. So that's coming up, and over and above that, maybe that's all that I wanted to say. So, right, there was one other thing. So about a month ago, I happened to come across this book. It was written 25 years ago. It's called something like The Miracle of MSM, or the MSM Miracle, written in 1999 by a couple of medical doctors from Portland, Oregon. And they were talking about high-dose sulfur therapy. And as I was reading through this, I remember actually seeing this book. I flipped through it, and one of my wonderful mentor from years ago, I was sitting in his waiting room, shadowing him for the day, and I remember flipping through this book, and that's actually why I had this jar of MSM in my kitchen for like forever, because I was meaning to try this high-dose MSM thing that I just had kind of forgotten about for years. So it was just kind of interesting how things kind of come around full circle sometimes, but very interesting book, probably available to buy online or various places. So anyways, I'll leave it there for now, and I hope this was of interest.